Hi there, I'm Joona Pylkäs from TietoEVRY Healthcare, and today I'm here to talk about the global trends and larger development that is reshaping the healthcare industry and its IT. So as we all know, the pandemic has forced all the industries to adapt, and healthcare is by far the one leading that adaptation, and we have very quickly innovated new solutions and launched into production. While a lot of progress has been made on the healthcare IT side, we have still some of the older challenges or the previous challenges that are unsolved, and we feel like a giant digital leap is still a very much needed thing. So why do we need a digital leap in healthcare? First of all, we are witnessing ever increasing costs, and those are becoming unmanageable here in the Nordics also. So if we look at the trend line for example, for Swedish healthcare spending, it has been increasing for the last 20 years. But also from a healthcare professional point of view, and what they are experiencing is that the art of medicine and delivering care is becoming more and more burdening, more stressful for the healthcare professionals. So we have over half of the doctors and nurses are feeling that they are considering leaving their profession, highly valuable profession. They are burning out, and they are not recommending a career in care profession. And these are numbers from the pre-COVID era. So we can imagine what is the burden now today with the increased effort that they are putting on a daily basis. And one of the reasons behind this burden that they are feeling and the stress that they are feeling is related to IT and software tools that they're using. So among the top causes for stress is administrative work and poor work support from the IT tools. So we definitely see room and need for improvement there. So what are the mega trends, and what is driving the development on healthcare IT? As we saw from the rising cost, that there's larger development especially in the Western societies, that is increasing the cost and increasing the use of care services. And one of those things is that we live longer, so the period of old age is much longer than before, and that means that when we are old, we use more and more health services and more advanced care. From an IT point of view, we need new solutions to manage chronic disease more effectively, and also solutions that enable the care providers to move some of the more advanced care from the hospital to the patient's home, but still keep an intelligent monitoring and connection with the patient. The rising costs are of course also putting a lot of pressure to increase the productivity within healthcare. And that means that we are moving towards more process or industrialized way of producing care and delivering the care, a lean and production model, just in time delivery of the care. And for that, from IT perspective, we need much better solutions for the production management that we can use to manage and optimize the resource utilizations and allocation within healthcare service networks. One of the things the COVID pandemic has impacted the most is the virtual care, and how virtual care is delivered, and what are the technological solutions used for the care delivery. But we believe that the virtual only is not the way forward here, or the best way forward. but we need a mixed model where the patients are first using the virtual services, but are then smoothly transferred to the inpatient in-person services, while utilizing services from multiple vendors in a network fashion, and also using even global or regional specialist network to provide the best possible care for even the rarest diseases and conditions. The other megatrends that we see that are highly affecting healthcare today and also in the near future are personalized care and precision medicines. These two are a bit interconnected, but still different things. We see that the personalized care is more about adjusting the care delivery and the treatment options to patients' software preferences, like living conditions and beliefs and so forth, while precision medicine is more driven by the use of hard data in a medical and a clinical setting, meaning that we create more precise and accurate data, like genomic data, that will affect the treatment decision and also enable the healthcare providers to deliver better care, higher quality of care, faster, with less side effects, and thus ultimately leading to better care at lower cost. Also, one of the big global trends that we have also seen being accelerated by the pandemic is the digital well-being, and how it's been now more and more interconnected with the clinical side, with the care delivery and care provided by the healthcare professionals. So we have a lot of new technological solutions and services that are generating all the time new data, new insights about our personal activity, exercise, the way we eat, how we sleep, and what's our mental condition at the moment. And also to support that development, there's now more and more consumer devices with the medical device created features, for example, for the heart-related data. So how are these bigger megatrends affecting the healthcare IT side, more from a technological point of view and maybe more from the healthcare service provider point of view? So what we see is being pushed now, especially by governments, is that there needs to be a more open technological ecosystems within healthcare and welfare. So the governments are moving away and promoting these standard-based interoperability and the need for vendor-neutral data. And these are really the key enables that allow the customers, the healthcare service providers, to purchase solutions in a modular fashion and use the best of breed approach instead of buying a one big monolithic big box for that is supposed to cover all the needs. Also, what is now being promoted in several different markets is this ecosystems. So governmental agencies, healthcare service providers, but also larger companies are creating and putting a lot of investments into creating healthcare and health-related ecosystems and multi-vendor platforms where that can be used to accelerate the R&D and innovation within the industry and really drive the IT renewal that we need. Similarly, and one of the area where the pandemic has increased and also pushed the innovation further is the cloud platforms. So especially when it comes to virtual care and patient engagement, the best and the most advanced solutions at the moment are delivered from the cloud. and the speed, the clock speed, how quickly they are being developed further is amazing at the moment. Especially in the Nordics, we are also seeing this domain integration where the lines between the healthcare, social care, and the patient, consumer, patient, citizen domains is becoming more and more blurry and more interconnected. So there's a lot more data sharing between the domains that used to be quite strictly separated. And of course, the ultimate goal here is that we can provide, based on the more holistic view on the citizen and patient, we can provide better care, not just care, but also assist the well-being and living of the Nordic citizens. And the last point here on the healthcare IT topics that are currently quite hot is that we are finally seeing, after years of promise, we are finally seeing operational AI, meaning production-ready AI solutions, making their way in the clinical environments and assisting the healthcare professionals in their daily life. So whether it's speech recognition and machine vision for medical imaging, there's a lot of new, exciting, and valuable solutions taken into production use during the last few years and months, and we see that progress will accelerate further in the near future. To sum up, our vision for the future is the value of the data-driven ecosystem that we feel that will accelerate the disruptive innovation within the industry. So for anyone to build this kind of ecosystem, you need to have the data as a starting point, and because that is the seed that you need to kickstart the ecosystem like this. And the more data you can generate and made available to the vendor network and the stakeholders, the better insights you can get from an integration of different data sets. And the better value and insights you can draw from the data, that increases the value of the whole ecosystem and the whole network, which in turn then attracts more vendors and more users that will generate more data, creating this snowball effect and a positive cycle that will grow even further. And as the ecosystem grows, also the benefits of scale will increase, meaning that the fixed cost of running the ecosystem and the platforms needed to support the work, those will be divided, the cost will be divided to more payers, while also that if you have more and more users for the solutions within the network, then the vendors can also decrease the price per unit. And as the total investment and the competition within the ecosystem increases and grows, that will also further accelerate, especially the disruptive innovation within the ecosystem and the industry, as the different vendors and stakeholders they need to compete for their place in the network. So this was TietoEVRY Health and Care's short overview of what's going on in the health and care industry and its technology. Thank you.